Hello, and thank you for joining. Today we're going to have a brief presentation regarding the normal aging process and dementia. So with age, our bodies undergo many changes. Some of these changes we have no control over, most of them in fact. There are some normal age-related changes that we expect, including with a person's memory and thinking. Dementia or severe memory loss that interferes with their daily life and activities, however, is not a part of the normal aging process. So we're going to learn what healthy aging is and what's not necessarily a part of the normal aging process. So what is normal aging? Now the aging process will start to affect us as early as 30 years old. So with these changes, some of the things that happen with the heart and blood vessels, some stiffening of arteries and blood vessels make the heart work harder. Physical activities such as walking long distances or walking uphill may start to become more difficult. With our bones, the bones shrink and reduce in density, making them more fragile and likely to break. The cartilage in our joints may start wearing away, which can cause some pain or stiffness with different movements. Our muscles lose strength, flexibility, and endurance over time as well. Muscle mass decreases 3 to 5% every decade after 30 years of age, and that rate increases once we reach the age of 60. With bowel and bladder, the ability for the bladder to stretch and then go back to its normal shape may be reduced. This may cause the bladder to hold less urine than before, resulting in more frequent trips to the bathroom. Changes in the bowel can lead to constipation as well, and this can be due to the changes in the digestive system slowing things down. Now with our skin, with age, our skin loses elasticity, resulting in wrinkles in some people. Our skin also thins and becomes more delicate, making it easier to get bruises and cuts. Even with a small bump onto a table or a chair, you may notice that you're getting some skin tears or bleeding or bruising more often than before. Now, changes in our vision can include farsightedness, a result of the hardening of the lens. Cataracts, which is a clouding of the lens in the eye that affects vision, may also develop. This can cause blurry vision and ultimately blindness if not treated. With our mental health, unfortunately, aging is a process that does include many changes, and it may take a little getting used to. Some people may experience depression, although others may have a sense of fulfillment and feel happy with their lives up to that point. And with our memory and thinking, or cognition, normal aging may mean slower processing speeds and more difficulty with multitasking. But routine memory, skills, and knowledge are stable and may even improve with age. It's normal to occasionally forget recent events, such as where the keys were placed or the name of the person you just met. So these are some of the common changes that we tend to see with the aging process. Now, some not necessarily normal things that we may notice with aging. There are a lot of things that we just discussed that happen with our memory and thinking. But confusion and memory loss that interferes with your daily life is not necessarily considered normal. So the word dementia, by definition, is a term for a collection of symptoms of cognitive decline, including disruptions in language, memory, attention, recognition, problem solving, and decision making that interferes with our daily activities. Although about 5.8 million people in the United States have dementia, it is not a part of the normal aging process. This is an MRI image of a healthy brain on the left in comparison to a brain of someone living with Alzheimer's disease. So you can see the shrinkage that happens. You can see all of the extra spaces that the brain tissue has, as well as the lining of the brain tends to shrink as Alzheimer's disease takes over. So the shrinkage we actually call atrophy. Now, some common signs of dementia are one, not being able to complete tasks independently. Maybe they need some cueing or some descriptions of how to complete the task. Difficulty with naming items or close family members. Forgetting the function of everyday items such as a phone or a toaster. Repeating questions. Where are we going today? Who are we going to see today? Even taking much longer to complete customary tasks that they've been doing for many years in the past. Misplacing items frequently, or not being able to retrace steps and getting lost. So these are some of the very common symptoms that we see with dementia, although these are not the only signs and symptoms that one may experience. So if you have some concerns about you or a loved one or family member that are experiencing some of the symptoms, it's important to talk to your doctor first because there are other medical conditions such as vitamin deficiencies or thyroid problems that could be causing very similar symptoms. Even infections like a urinary tract infection can mimic these dementia-like symptoms. Now, in addition to that, there are some medications that can also cause dementia-like symptoms. So if you are experiencing these, it's important to talk to your healthcare provider to see if they can do some research to see if they can get to the bottom of what's really causing these symptoms that you're experiencing. So some ways to keep your brain healthy. Some chronic disease prevention. So if you're a smoker, stop smoking. Maintain a healthy blood pressure level. And if you don't know what that is, you can talk to your doctor and they can give you your healthy range. Also, make sure you're managing your cholesterol levels with exercise and, if needed, cholesterol lowering medications, as well as keeping your blood sugar in a healthy range. And your doctor can let you know if you're in range or if you need to work on that, and they can give you some tools to help. It's important to also maintain a healthy weight so the rest of your body can stay in adequate shape to perform at its peak. Now, if you do drink alcohol, moderation is key. So it's recommended if you are a drinker, 1 drink per day for women and up to 2 drinks per day for men under the age of 65. And up to 1 drink a day for women and men over the age of 65. If you are not a drinker, don't start. That's going to keep your brain at its healthiest. Now, we want to make sure we reduce hazards in your environment that could lead to falls or head injury. Also, healthy living, just an overall healthy lifestyle. So eating whole foods with plenty of nutrients and vitamins. Getting plenty of exercise, specifically your aerobic exercise to get your breathing and heart rate slightly elevated, and getting good quality sleep where you wake up and feel rested. Also, making sure you keep your mind active and stimulated with challenging tasks such as learning a new activity, as well as maintaining social contacts. Socializing with people outside of your household at least twice a week can be incredibly stimulating to the brain for having those back and forth full conversations. So if you are noticing some memory concerns, write things down. Keep a log of your concerns, of your family's concerns, your friends' concerns, and take that list to your doctor so they can see what's going on at home. You can also request a memory screening. Here at the Villages Health, we offer a MOCA, which is the Montreal Cognitive Assessment. It's a completely free assessment that triggers 8 different areas of the brain, and it'll show where your strengths and weaknesses are. Now, you can also check with your family and friends for their input. They may notice some changes with your memory that you may not have noticed. They just didn't want to bring it up to you because they're waiting on you to bring it up to them. So this happens often. So ask them if they're noticing any changes, and then take all of these things to your healthcare provider so they can get a better idea of what you're noticing, and they can hopefully get to the bottom of things. I hope you have enjoyed this brief presentation. If you have a cell phone, you can take out your camera, scan this QR code, and leave us an evaluation to let us know. Your feedback is incredibly important, and I hope that you have a wonderful day. Thank you.